Before we start, check out my brand new 40-120 transformation program, the ultimate fitness coaching program for men over 40. Click the link in the description to learn more about it. Hey guys, Nick Drossos.
And Dr. Laurent here.
And welcome to Man Yourself Up. And Doc, what are we going to be manning up today?
We are going to talk about sexual wellness, men sexual wellness. So it's an issue that I have almost every day in my practice. Men from 20 to 75 or 80 will come for specific problem.
What's the most common one? Is it erectile dysfunction? That's
It
what we
is.
think
It is
Okay.
the one. It is the one. So people will come for, it will come with many other problems. Okay. They will come, they will tell you, they won't tell the nurse.
Okay,
Usually.
it's true.
They won't tell the nurse. They will come to you and tell you, Doc, let's say I come for my high blood pressure. Okay, fine. So how can I help, Doc? How can you help with the men getting up? I'm like, oh, okay.
You can't even say it, right? We
You
got the
can't even
man
say
getting
it.
up.
I'm like, it's your penis.
Yeah.
It's called erection. So
Yeah.
yes, it's always a moment for me to educate them about their anatomy, about what is happening, about their health. Personally, I always tell them your sexual health is always a shadow of your overall health.
I love that. Yeah.
Yes, people don't think about that. We have many factors that can affect it. Let's start by psychological, vascular factors, neurologic factors, okay, like sensation and stuff like this. Okay, and yep, those are the ones that I have on the top of my head.
What's the most common one? Say
Vascular.
for vascular.
Vascular, yes, but let me say, I would say more psychological than vascular, usually. Vascular is, a bit further, more psychological. Most people will come with having a problem for an erection. We have many questions. There is one called the Adam questionnaire.
Adam questionnaire? Oh, yeah.
Yes, that you go through with them to see, can you have an erection if you are thinking about sex? Are you aroused with porn and stuff like that? And they will answer questions usually. Most of them will still have a morning erection, can be aroused by subjective images, and also can have an erection, but sometimes cannot hold it for long. So those are the things that we can go through today and think about
How
it.
do you assess which one it is? Like for you in terms of, and how do you deal with each one?
Each one,
Yeah.
well, let's say for psychological,
Therapist, sex therapist, I'm assuming.
sex therapist, not necessarily. You are your best sex therapist. You need to discuss with your partner.
Good point.
Yes, if your partner is pressuring you about sex, let's talk about it. Let's sit down and talk about it. What do you want? What is your need? What is my need? What do we want? We need to, let's say we need to stand on something, we need to agree on the sex that we want to have. People don't think about that. Agreement in sex is necessary for, a good sex well-being. So
I think probably the main issue is as men we have a hard time talking about that, and it comes down to the partner, how open she is, how receptive, and
exactly. The
communication
partner,
at the end,
exactly.
right?
Always communication. It depends on how the partner is open to talk about that. The men can have a problem, and the other partner can have, even a man or a woman can also have their own problems. Okay, and also some people sometimes psychological can bring a lot of subjects on the table.
I'm assuming
Oh,
other, yeah.
yes, other subjects like, let's say, preferences, S&M, yes,
A what?
abuse,
Abuse, okay.
yes, drug use,
Okay.
a lot, a lot.
What does that mean, drug use? Like you need to take drugs?
Some people take drugs and have sex.
That's their thing.
That's their thing. Well,
But
let's say
doesn't drugs make it worse? Makes it better? Like,
yes,
I don't do
make it
drugs, so like
worse. I don't do drugs either, so I can't tell you about the side effects because I haven't experienced that. So I had no experience on that personally. But some people have sex and take drugs and have sex, and after that they are trying to get to that same level of high they had after. You cannot have it without drugs, so they will come to you. So every time a person comes to me with that kind of subject, I have a questionnaire that is very long that I go through with the person, and we assess together.
and and you see 20-year-olds come to the office with this
Yes,
issue? And
the
most of the time it's probably psychological, right?
exactly
Probably
the
porn. I'm sure porn has something to do with it.
masturbation too.
Oh, wow. Okay.
Yes. Let's say don't have a problem if someone is masturbating 2 or 3 times a day, unless it, it makes your life difficult,
Okay.
unless you cannot stop doing it.
So you become addicted to it?
Yes,
Okay.
it happens to a lot of adolescents. Usually all men had a moment in their life that we had a lot of masturbation done. So all of us, we did that. So the ones that will tell you that they never masturbated are pathological liars. So yes, we all do. We all do. Let's talk about that. It's something that we don't talk about.
Wait,
That
can you okay, I mean, I guess you answered. Can you over masturbate, but like
you could.
is there any side effects to it?
No, I
Anything
wouldn't
good? Like
say that. It's
is
I've
is
seen I've had a couple patients. Okay, I had the one that I remember well is that young guy who came with for a rash on his penis. He was 15. And I was like, okay, do you want your parents to be there or
yeah.
and it was her mom. And mom said, well, I know that he masturbates. I'm like, well, maybe too much. And we laughed about that. And I explained to him how to do it properly, not use your bare hands, just use a lubricant or soap or cream, whatever. Just make sure it's hydrated, you will have more pleasure. So people don't, us men think that masturbation is something that is very easy to do. It's sex actually.
Is it? Well,
It's
I mean, yeah, I mean,
self-sex.
self-sex, yeah, when you think about it, yeah.
It's sex. So you need to. It can be also a way to know yourself.
Okay.
Yes.
What do you mean?
Yes. It's to know your limits.
Mm.
Yes, to know what you can do, what you can accept, what you cannot accept. Some people need to leave their fantasies sometimes, and they will do that through masturbation. And porn idealize sex now.
What do you
It's
mean? What do you mean?
yes, people will come to you and tell you, "I want to have sex for like 2 hours and not coming." I'm like, "Well, no, it's impossible. You cannot do that. You need to, you need to come at a point in time." But they will tell you that. They will tell you, "Well, I've watched this and that."
Especially when you're young, you believe it. You watch it and you think like that's what I'm supposed to do.
And
And-
no, it's not what you're supposed to do. What you're supposed to do is what you can do. You know, we the other thing that I opened up to recently, is elderly's
Oh,
sex
wow.
life. Yeah.
I think there was an article about it that
Yes.
like it's
They
but-
still have sex. We still have sex in our 70s. We still do. Men, it's normal. for the society presented like it's normal for us men to have sex around our 70s, but not women, you know. I consider us equals, so
Yeah.
we can have it at any point in life. So sex, sexual well-being. Let's go to vascular.
Yes.
Vascular issues. Let's say that you're diabetic and your diabetes is not well controlled. You will lose some sensation. So, in case of diabetes, it's a bit complex because it's two things at the same time. It's neurological and vascular at the same time.
Oh, wow.
So, erection in a patient with let's say a chronic disease can tell you how healthy the patient is. It's a complex thing, you know. Having an erection is very simple and
Yeah.
complex at the same time. Because we can have so many factors that work into that will give you one or kill it.
And in that case, do you prescribe Viagra, Cialis? What do you think of those?
It depends. It depends.
Are
We
you
can
for
try.
that, or you're? I mean,
Well, I am a doctor.
Yeah.
Okay. I will try things with you, and the best treatment for you is the one that works. So if Viagra works for you, that Cialis works for the other one, I won't
what's
give
the
the
difference
same
between
thing.
the two? Most people don't
Those
know.
are PDE5 in inhibitors. So what they literally do, they keep they do a vasodilation.
Okay.
Okay, and they keep your veins open. What they do, they keep it open, and the blood stays there easily. And some people with Viagra or Cialis, the most common side effect is nasal congestion and headache.
Nasal congestion.
And for you to know
Why would
if
you
it
get a
is
headache?
if it is working,
Yeah.
when it's working, you are congested.
Oh wow.
Yeah,
And
you
why
have
would
to experience that
why would you get a headache?
because of
Blood flow.
the vasodilation. That's easy.
And what's the difference between the two? How do you know which
It's the same class, you know. It's just the moment they came out. The other Cialis is newer. It stays longer.
Okay.
Okay, Cialis can stay in your blood for up to 72 hours. Yes, that's why I prescribe it. 4 pills. Okay, I will tell you take half a pill every 3 days,
Okay.
and you will have a better erection.
You'll be a rock star.
Yes.
And what's the difference then with Viagra?
Viagra that usually you need to take it just 1 hour to 30 minutes before action. Yep. I cannot tell you to take a Viagra every day. Well, some people do. Some doctors will tell you take a Cialis 5 every day.
Okay.
So at a point in time, it becomes, it will become your usual.
And then it won't be as effective? Like
It will be as effective,
Oh, yeah.
but you won't see a difference.
Okay.
Okay. Some people with psychological issues will come to you, you will give them the Cialis that will help them. That will help them for a period of time, and they won't need it after that.
And what about natural supplements? What would you like? Is there like I remember we had talked about in the past L-arginine, there's citrullis.
No,
There's
I am not a specialist of that. I would prefer not to get into that because I don't know them specifically. I don't know how they work. So I know, man. I am a honest man. I will tell you when
that's
I
what I
don't
love
know.
about you, Doc. Yeah, for sure. What's the other one? So I think the most common one we hear is that.
Viagra, Cialis, Levitra. Those are the ones that we have on the market. Those are the ones that I have on the top of my head. So also some medications can make you have a less hard erection.
Oh, that's interesting.
Blood pressure medications.
Oh.
I am not telling you guys to stop taking it. Okay. I'm telling you to talk to your doctor first to evaluate with your practitioner which one is better for you, because some people will tell you, I won't take that class because it does this to me. Not necessarily. Not all of them do have the same action.
Do
No.
you prescribe, like, if you give somebody that type of medication, you'll tell them, hey, this might happen, you'll take a Viagra or
Yes, I
Cialis?
will tell you. I will tell you. I will tell you if you see that you it's more difficult to have an erection, just come back and see me. We will discuss that together.
What would you say is the next, like, so you have erectile dysfunction, what would be the next one, the most common one?
My God.
Would it be premature ejaculation? We've talked about this one in the past.
Premature ejaculation. People, confuse it with erectile dysfunction.
Oh, explain.
Yes. People will tell you, I come too fast and I cannot have an erection. So every single man on earth need a period of, pause between moment that you have the pleasure.
Yeah.
Okay. So some people it takes minutes, other people it takes, hours. So the older you get, the longer it becomes. So,
Wow.
yes, it doesn't.
Is that factual, or like, even if
It's
you're
a fact.
even if you're healthy?
Well, it's a fact. When I'm saying younger, young doesn't necessarily mean age.
Okay.
It's let me rephrase that. The better your health, the shorter it is.
Yeah.
So let's say that you are 60 and you're working out, you're healthy. Let's say that your metabolic age is 40. You will have a
You'll be good.
good. Yes, exactly. Yes, that's how it works, man. I have patients who are, let me say 35 to 40. They will come to me for premature ejaculation. I had one that was brought by his wife. The wife came. She was like, tell him.
That's got to be a little bit embarrassing.
I'm like,
Or
what?
a little bit
Tell
like-
him what? I'm like, she was like, he needs to tell you about it, doc. I cannot do this anymore. He needs to help me with that. I'm like, okay, let's talk about it. The guy was all shy about it. I'm like, is it the man that cannot go up? He was like, how did you know? I'm like, well, she told me.
Yeah.
She literally told me.
When your wife is bringing you there, you're like, uh-oh.
Use it, doc, use it. But another cause that people don't know about, when a man comes with erectile dysfunction, you have to evaluate him. Many issues like hypothyroidism.
Hypo what?
Hypothyroidism.
Okay.
Okay. Low testosterone can happen, So hypogonadism,
What's that?
low testosterone
Oh, yeah.
production by your testicles.
Okay.
Also, I said hypothyroidism and hyperthyroidism too.
Okay.
Thyroid issues can do that to you.
Thyroid issues. Okay.
Yes, because your thyroid is responsible for your metabolism.
Okay.
So, bro, anything can happen. I had this 33 man. He came to me telling me, Doc, I cannot have an erection. We tried Viagra on the spot. I had some. And nothing worked. He came back a week later. I was like, okay, let's do some blood test. He had a hyperthyroidism
Wow.
that I found out just because I just took a blood test. I'm
Yeah.
like, I don't like this. That even Viagra is not working. Let's do something. And the way we followed him is by his erection. He couldn't even have a, morning shine.
Wow.
He couldn't have one. So I think it took him 2 to 4 months to be able to have sex again.
So he took the medication.
He took the medication, and now he's normal again.
Wow. So just that.
Yes,
So
just
it's like
that.
so it's a chemical imbalance. Is that?
I won't
Not chemical imbalance, but
say not chemical itself, it's it's an issue. It
hormonal.
could be hormonal, it could be vascular, it could be neurological, it could be metabolic, it could be due to medications, could be psychological,
Yeah.
biggest one. And pressure, peer pressure.
Yeah.
Peer pressure is important because most young people under 30 that will come see me, they will tell me, okay, my friend went to the doctor. He's taking this or that medication. I would like to have it.
Like what, Viagra or Cialis you're talking about?
Yes.
No
I'm like,
way. At
why?
that age?
I'm like, why is he taking it? Do you know why? I don't know. I just want to have it. I'm like, well, if you want to have it, I need to evaluate you for that. Do you have this or that problem? No. I'm like, well, it's not appropriate for you. So why would I give it to you?
Yeah.
Explain to me. Just put me in context. And usually you will see it's peer pressure or the partner that will come to you. And there is a trend now more homosexuals will come for that because they will go to those parties, those saunas. So
Okay.
they want to be up all the time.
So there's a risk when you have it. Like, if you, can you
Yes.
take too much? Like, I don't know.
You can take too much, and just one Viagra can give you that side effect that you don't want.
What's that side effect that I don't want?
Having an erection for 6 hours.
And what happens then?
Oh yeah, they will have to drain it.
Ah, that must hurt. What is that? What does that look like? Draining it.
Draining it is sometimes if there is no clot, they will use a big needle or surgery. Sometimes that's a
Go into the-
urologist. Yes, that's a
Yeah.
urologist thing, and they will do it easily. But myself, as a family doctor, I will consult urology.
Yeah.
And that's what I will do. Let's go back to premature ejaculation. People don't know how to treat that.
Yes. So
Actually, there is a treatment for that.
what's
Aha, you don't know it.
well the thing we've talked about in the past, which I'm not crazy about, were antidepressants.
Yes, it's a SSRI, but
Yes.
a very low dose of citalopram treats it. Because what does the citalopram do? Citalopram makes you take more time to have an ejaculation. So that's a treatment basically. A small dose. Let's say if I use Cipralex, which is a medication that I really like, milligram dose, and it helps. It doesn't decrease your libido or anything like it.
But would it, like, isn't it taking that? Doesn't it like slow down all of your system?
Not necessarily.
Okay.
Unnecessary doesn't necessarily do that.
Okay.
It slows down your system. Let's say in anxiety, you're too high, right?
Yeah.
So bring you back. Depression, you're too low, brings you up. So it's always a balance. Always a balance.
Okay.
That's what I tell my patients. I'm like, okay, do you think this is the problem? So have you been aroused too much? Have you had sex before? Is it your first time? Are you too young? Is it a new partner? Were you stressed? All those things can make you have a premature ejaculation. Yes. If you're stressed, if it's a new partner, you're like,
I
don't know.
I guess anxiety probably triggers something.
oh yes, some anxious people will just get one out of the blue.
Just
If they have a panic attack, they just have it.
oh, wow.
I've seen this.
And all that is, I mean, it's all connected in your
It's
system.
all
Like,
connected in your system.
I'm assuming you have no control over that, or
You
do
don't. The thing that you have no control over erection or ejaculation. You have no control. If you want to stop it, you have to stop what is making you having it.
Okay.
Let's say that during sex, if you don't want to have ejaculation right away, you have to stop
Yeah.
for like 2 seconds and take a deep breath and
Yeah.
go back again. So
We had a doctor in the past come. It was a pelvic floor therapist, and he
Mm-hmm.
said there's like pelvic floor
Yes, pelvic
exercise.
floor therapy can help you having a better erection, retarded ejaculation, and let's say, um, how do I say it? Un jet plus fort. Là.
Okay.
Yep. So all these things go together. They go together. Pelvic floor, exercise, obesity is something that people don't think about when we have abdominal obesity. So it makes life
Why
difficult
does that affect so much? Like the obesity, like
because, you know,
I
in men, usually the fat we have is intra-abdominal.
okay.
So it squeezes all the organs that are inside your belly. And let me tell you, your abdomen is not a big space. You have a lot of bowels there, a lot of poop in there.
Right.
Stomach is full sometimes, and you have your bigger order on the back. So you have your kidneys, you have all your glands there. So people don't think about that. All your metabolism, most of them goes through that region, through that abdominal region. So, obesity is something that people don't think about. Just a compression of your arteries can make it difficult for you to have an erection. So, don't think about that. And let me think about another issue that just popped in my head but went away.
Yeah.
Yep.
Oh,
You know, all these things can help people understand why you have a better erection than the other one. So let's not say all 40 years old are not equal.
okay.
We're not. No, let's say that you are overtrained. Let's say you are
Yeah.
overtrained. I am taking tea, and my friend here doesn't, is taking a medication. We are all
Good point.
in our 40s.
Good point.
Or him, he has a chronic issue. We are not equal.
Yeah. Good point.
We are not. So I will repeat that again. Erection is, you know, is the reflection of your well-being, is a reflection of your overall health. If you're anxious, if you're depressed,
Good
you
point,
might
good
not
point.
be able to have an erection. If you're anxious, you will have premature ejaculation. Let's go there.
Yeah.
If you're taking a big dose of SSRI, you won't have a libido. You won't have, you don't want to have sex because you are, on neutral. So,
Well, it's interesting. Like you said, it's interesting because when we look at all these different type of illnesses, it's not an illness, but different things, issues, they all come down to just get healthy overall. Keep your
yes.
health in check, eat well, exercise, drink water, sleep, meditate. It always
Oh,
comes down to the
yes.
same baseline.
It's always a baseline. We are mammals. Okay. We need to sleep. We need to eat healthy. We need to exercise. We need to look for our food. Actually, in North America, I can sit there and ask for 3 pizzas and they will come to me and I will
Sure,
eat
yeah,
that.
good point.
And I don't need to walk. I will take the elevator. I don't need to walk home. I don't take the bus. I will take my car.
Yeah.
So less exercises,
It,
bigger bellies.
it's interesting because as a trainer, when I've had men clients start,
Hmm.
and within 3 to 6 months they start losing weight, getting in shape,
Hmm.
they're always like, "Nick, can I ask you something?" I'm like, "Yeah, sure." Like I'm a lot better down there. I'm like, "Yeah,
Yes,
it's because you're
exactly.
eating well, you're exercising, you
Exactly.
lost weight, you're doing
It's
cardio, strength training,
exactly
your system is like running
your
full force."
your vascular
Yeah.
system is running well because when you exercise, you will have the nitric oxide
Yeah.
that will and Viagra works on nitric oxide actually. So that's what they do. They make it, come out and then and dilate your vessels. And you can do that naturally by exercising.
What about this myth of watermelon? Should I eat a lot of watermelon?
I don't know about
Oh
that.
yeah, that's
What is it?
yeah.
Tell me
No, no.
about it.
I've
Tell me.
we've had in the past like a nutritionist, and she was saying like watermelon, pistachios. There was like some food.
Pistachios, I know about it. I know about pistachios. It's all about NO. It's nitric oxide. Okay. I know about some, some. I know about there is that. Oh, okay. I forgot the
Like
name.
food you're talking.
It's a food. It's food. It's aphrodisiac. Um, patient fruit
Okay.
does that too. We had conch meat.
What?
Conch meat.
What's that?
You need to go to Jamaica or Haiti or the Caribbean to
Yeah.
have it. Yes, it's something become like this. Yes,
What's it called?
conch meat.
Conch meat.
Yes.
What is it? Meat?
It's not a meat. It's a seafood.
Okay.
It's a seafood. It's like that it's complicated. I need to show it to
It
you.
really does work. You've tried it?
Bro, I'm Haitian.
Yeah, you
I've
don't need
had
that stuff.
many. I don't eat that stuff.
No, I said you don't need that stuff.
I do eat it, actually. I love it, actually. I love it. I went to Haiti last September and I traveled, I think, 200 kilometers to have some.
Oh wow.
And it's an exotic food. You usually find it near beaches. They will cook it for you and it's superb. And they usually call it lambi. You will hear the name lambi.
Okay.
If you go to Haitian places, you will see the lambi written there. But it's expensive, very expensive.
I like my griot, man. I don't know if that does anything.
No, it does. It does actually. But patient food, I don't know about it. Aloe vera does it too.
For real? It's the first time I hear that one.
You didn't know that. Aloe, yes, it does it.
So those are the food. The men are going to start eating a lot more of those.
Yes,
But it's all healthy foods. As simple as
healthy
that.
food.
Yeah.
It's simple. Just make sure that you eat your salads, that you eat your meat properly, properly cooked. Okay. Also, just make sure that you eat your, all-grain cereals. Make sure that they are complete cereals.
Eat well, exercise, sleep well, meditate, communicate. Simple. It's always the same. It's always the same formula. It's the baseline.
Baseline. So it's not complex. It's, always talk about it.
Yeah.
Talk with your partner. I don't mind what is your preference. If you're a man, if you identify as a man, if you have a penis, okay, you might experience that issue one day. So talking about it with your professional might make a difference.
Yeah.
Talking about it with your pharmacist can make a difference because pharmacists are not used properly in the community because people usually think you need to see a doctor. Nurses didn't know about a lot of it, sexologists, sexual therapists,
Yes.
they know a lot about it. So why not? We need to use them. Psychologists, a lot of issues, a lot of different issues that we have, we need to use the right practitioner for it. If I have a psychological issue, I can help you with that. I will mostly send you to a psychologist or to a sex therapist. If we have a vascular issue, I will send you, let's say to endocrinologist if it's diabetes or vascular surgery or urology. If we have a neurologic problem in that region, we will send you to urology. Or if we have a dysfunction or that is more complex, many professionals then.
Yeah.
And we need to make sure that people, let's say we need to evaluate them properly. Just don't say Viagra for everybody.
Yeah.
Do not say SSRI for everybody. So the best treatment for you is the one that is working.
Yeah.
So
And do everything you can first the good way. Eat well, exercise.
yes, make sure.
Do that first.
Make sure,
Right?
make
Because
sure.
it's an overall lifestyle, long-lasting, healthy way. It's going to be
Live
there's so
like a
many benefits.
mammal, man. That's easy.
That's it.
Live like a mammal.
So I think we're going to leave it at that, Doc. Guys, live like a mammal.
Yes, take care of yourself. Search your food.
That's it. And don't forget, man up.
Yes.
Talk about it. Don't be shy. Don't be scared. And
Come see us.
if you guys have any questions, Doc, where can they find you?
They can find me on Instagram as a professional. They can also find me in clinics at Medical Music. They can come and have an appointment with me. I will be happy to see them.
Perfect, guys. I'll put the link there and we'll see you guys next week.